everybody from Germany. So I'm very happy to be here and to talk about fundamentals of OT lights. Let me just share the screen in a second. My name is Markus Keussen. I'm the Managing Director of Siemens Medical in Germany, and I will guide you through some basics of operating lights. Let's just start with a couple of physics. What you have seen or what you see all in the brochures, for example, for lights for decision making. First of all, the most important thing definitely is lux, which is the indication of the intensity of a light in a certain area. What you see normally, OT lights have about 120,000 to 160,000 lux at 1 meter distance from the light to the surgical field. The maximum, according to norm, is 160,000 lux, so it cannot go beyond. As a comparison, examination lights in general have about 60,000 lux at 1 meter distance. So just as a comparison. So this is one of the major indicator of operating lights. The second thing is the color temperature. Is measured in Kelvin. So the color temperature, you may recall from halogen lights, they have been a very warm white light with about 3,500 Kelvin. The daylight has about 4,500 Kelvin, which is the ideal condition for the human eye. And 5,500 Kelvin is kind of bright sunlight. So modern LED OT lights go from different differences in the tissue. So the next thing is the color rendering index, CRI. The CRI is measures the ability of a light source to reveal colors in comparison with an ideal or natural light source. So if you have a low CRI, you can see on the lower right side in the picture, then it's kind of all the colors seem to be very similar. If you have a higher CRI, which is maximum 100, then you can see differences in the different colors, which is very important, for example, to consider the different status of the perfusion of tissue, for example. Then there's another example of the physics, the depth of illumination, which is L1, L2. So this really describes the area where homogeneous field can be refocused or without refocusing of the operation. And so it can be realized without refocusing of the operation field. So this is the area of a very harmonic light column, as you can see, which is the ideal working area of a surgeon. So this is basically at about 1 meter plus minus distance from the light to the surgical field. So in this area, you do not need to refocus while operating, and you still have the same light quality. Then there is another number that you always can see when deciding on lights, or when you see numbers in the brochures, which is the light field diameter. It's called D10 in millimeter. And this indicates the size of the light field from the center of the light with the highest light intensity to the point where only 10% of the maximum light intensity can be reached. And this all is measured at 1 meter distance from the light to the surgery field. So modern LED OT lights have a small light field, for example, only 180 millimeter, and can be readjusted to something like 300 millimeter. And this is very important. For example, for deep cavity procedures, you need a small light field. And for larger scale procedures, you may require a larger one, so you can basically refocus during the operation. Another very important thing that you definitely see while operating, especially if you're operating with a larger team, is the shadow resolution. Shadow resolution describes the possibility to reduce the shadows in the operating field. For example, if there are a couple of heads in the field, surgeon, assistant, and so on and so forth, by a larger light emitting surface of the light. So the shadow resolution describes the remaining light quality in the surgery field, which is kind of important so that you can move on your procedure without any kind of shadows. So you have different light systems. For example, on the left-hand side, you see our product, which has a quite of high shadow resolution. And on the other side, you see a product that has differences in different areas, so to say, of LEDs that has a kind of lower shadow resolution. There are a couple of technologies. You may all know the halogen technology, which is from today's technical point of view outdated. The halogen bulbs, they become very hot, especially your head below a light becomes very hot. They have very short lifetime, which is only 1/5 to 1/6 of an LED. It has, from the construction point of view, a bulky housing, so it's kind of difficult to readjust, and they are always a little bit heavier. Normally, most of the lights cannot be dimmed, so there is no difference in the intensity of the light possible. Halogen lights in general have a kind of low shadow resolution due to the technology, and last but not least, all in all, a very high power consumption. So they are kind of outdated, and you see for the last 10 years, more or less only LED technology. There is definitely two different technologies on the market. One is the LED lens technology, where an LED emits light through a lens to the surgical field. So it's an indirect emission of the light. Then you have, and this is because it has to go through a lens, it becomes quite warm. And it also has, due to the fact that the lens is not always absolutely pure, a kind of mixed color temperature in the operating field. So you can see some shades of a little bit warmer white, colder white, and even some reddish or greenish in the operating field. And all in all, also due to the construction of the light itself, it has a lower shadow resolution, as said before in the previous slide. And then there's another technology that we use, that is the LED reflected technology, in which an LED emits the light directly through a reflector to the surgical field. So there's a direct emission and direct reflection of the light. It is very cold because all in all, it's the power consumption is quite low, and there is no warming of the surgeon head. And all in all, the ones that use laminar flow, it is really laminar flow optimized. Another advantage is there is no real mixed colors in the surgical field, so it's a pure white color and a true color with a kind of high shadow resolution. And it's also important that LEDs can be dimmed, so from approximately 40,000 lux to then the maximum 160,000 lux. And moreover, many of the LED lights have an endoscopic mode, where you just need to have some kind of very low light in the environment with 3,000 lux. So you can see there's a couple of technologies. LED definitely is the latest one. There is two versions, lens and reflector technology. Many of the users ask us, what kind of light should I take? I mean, there is a different system. Is it one light? Is it two lights? Is it three without monitors? So it depends, we have to say, but overall, a general operating theater needs to have a dual light system. And we call it normally a main light with 160,000 lux and one satellite with something like 120 to 140,000 lux that then can be optimally positioned in the surgical field. However, if you are in a cardiac OR, you need to have a triple light system because, as you know, there is a minimum 2 teams working on the patient. So you need to have one main light with 160,000 lux and 2 satellites with a minimum 140,000 lux each. Many choose 160,000 lux lights due to the fact that they want to have the optimal light, but also work with a lot of people around the patient. And last but not least, there is the hybrid OT, in which you have, imaging, you do endoscopic procedures and so on and so forth. So you need to have pictures that you need to view during operation. So you do not only need lights, but also monitors. And in most cases, due to the location of the patient and the instrumentation, a decentralized dual light system is chosen with monitors. So you have one light with 160,000 lux, the main light with a monitor, and one satellite with a monitor. So overall, it's 2 lights and 2 monitors. So that is kind of rule of thumb. Definitely, it's also the choice is according to the hospital, but also to the surgeon's requirements. Another question came up, how to position the light during operation. Well, we have to say it depends on the surgery, because there is no general rule of thumb. But if we should choose this kind of general rule, it's that you should basically position the light heads quite close within the homogeneous light field. So within this harmonic light column, which is something like 1 meter from the surgery field. This really improves the shadow resolution and also the best surgery field illumination. So close positioning within this harmonic light column is the best choice of positioning. Another topic is always what we see that during the day, many surgeons are kind of exhausted because, especially LED lights are quite bright compared to halogen lights. So overall, we know that the level of concentration of a surgeon is enhanced by using illumination similar to daylight. So what I said, 4,500 Kelvin. So this really prevents that melatonin is produced by metabolism, the circadian effect that causes fatigue and exhaustion. So our recommendation is really to start the surgery of the day with about 50% of the intensity of the light only, because you will see, and that's probably what you encounter also in your experience, that you increase the intensity throughout the day. And this definitely also reduces then fatigue and also exhaustion. So start lower and then you can ramp up during the day. So as a summary, what makes a good OT light? There's definitely 4 topics. The first of all, you need a good light. The superior light quality is really key for a good operation and a safe operation. So high central illumination, a very homogeneous light field, natural light and also daylight quality, so that your fatigue and exhaustion is reduced, a high depth of illumination in the working area, and a high shadow resolution. So light is the key. Secondly, during operation, there is sometimes, you need to refocus, you need to change the functions. So very intuitive, non-sterile control is important. For example, at the cardanic control of a light, but also sterile, because the surgeon himself wants to reposition and wants to refunction the light himself, as a matter of fact. So a sterile control of light, for example, via the sterile handle is also important. Secondly, perfect balance is important, because once you position the light, it shouldn't move away. It should stay where it is, so that you can proceed with the surgery. And also important is to have a high range to position the light to also a very low position, because there's a couple of seated surgeries, for example, knee procedures, where you need to have the light very low position to the patient. Then superior hygiene durability is very important. Hygiene, especially in the operating room. So robust materials, as what we do, for example, aluminum housing and safety front glass is important due to the fact that it can be easily cleaned. It also has a low heat radiation, and it's also important to have long lifetime of the LED. And in general, we say 60,000 hours. So just calculating, it's more than 10 years without changing any kind of light, any kind of LED. Last but not least, good serviceability, because you require a 24/7 availability of the light, also for procedures that are not planned. Last but not least, versatility. So what we see also in the market is to have multicolor lights, that you can adjust the color temperature of the light according to the personal preferences and according to the procedure. But also what we see more and more is the required camera preparation for all lights, because especially in university hospitals and other areas, recording and streaming of the surgery becomes more and more important. So once you invest today in a light, you definitely should also be able to use a camera, maybe immediately or in the future.